Just the facts, ma'am.
Hey y'all, this video isn't just for preppers, it really applies to everyone. When I came across this information a couple of years ago, I was truly horrified by it. And if you're wondering, no, I'm not going to be repeating the old stories that we've all heard that if you're an organ donor, they may not work to save your life or they may let you die just so they can harvest your organs. Oh no, this is far, far worse than that. I debated how to present the information because I know people that watch YouTube videos have extremely short attention spans. So what I'm going to do, I'm going to bullet point the facts up front without any references. And you're probably going to be thinking at that point, there's no way this could be true. This is too horrific. Oh, but I assure you it is very true. After I bullet pointed the facts, I'm going to show you some source documents. And they're from very legit sources, from medical journals, from the actual procedural manuals turned out by organ procurement organizations, federal laws on the subject, and a number of other things. Okay, so let's begin. First off, vital organs can only be harvested from a living, breathing body for which the individual has been declared brain dead. And vital organs are the life-saving organs, the heart, liver, kidneys, pancreas, intestines. Tissue donation, on the other hand, that can be harvested after clinical death, and tissue is skin, bone, cartilage, corneas. The vital organ harvesting procedure takes between 3 and 6 hours. During that time, the heart is beating continuously, and the heart is actually the last organ they harvest. They either shut it off or they remove it, and at that point, the body is considered dead. Now, during this 3 to 6 hour procedure, the individual is not given any painkillers or general anesthetic whatsoever. They are, however, injected with paralyzing drugs, so there's no way that they could possibly move once the procedure starts. Now, under normal circumstances, if you went in for a typical surgery, if your vital signs spiked when they started to cut you open, the anesthesiologist would take that as a sign that you are not under deeply enough, that you are responding to pain, and they would increase the level of anesthesia. In the case of organ harvesting, it is extremely common for the vital signs to spike when they start cutting the body open. It's also common for the individual to start moving, flopping around and such. As a result, they shoot him up with paralyzing drugs, so there's no way the individual can move. Of course, as most people know, using general anesthesia is risky. A lot of people can die, especially if they're in bad physical shape to begin with, and so they're not using it because they're concerned that the person could go into cardiac arrest in the middle of the procedure, and if they can't revive them, they're going to lose any organs that haven't been harvested at that point. Now, you may be thinking it doesn't matter if these people receive anesthesia before the harvesting procedure because they've all been declared brain death, and that means that they've used really sophisticated tests to ensure that diagnosis. In fact, there are no standards whatsoever regarding the tests that need to be run before somebody can be declared brain dead. Many states allow any doctor or even a nurse or a nurse's practitioner to make the diagnosis of brain death. In addition, they can use all kinds of extremely rudimentary tests, such as unplugging someone from a ventilator to see if they can start breathing, or checking their pupils for a reaction to light, squirting cold water in their ear, or giving pain stimulus to see if they respond. All of those things could be used to say that this person is now brain dead. Anesthesiologists are often the biggest critics regarding the policy of not giving any anesthesia during the procedure. They are present because they're monitoring oxygen levels and blood gas and things of that nature. And here is an article where an anesthesiologist talks about his concerns. Nurses get really, really upset. You stick the knife in and the pulse and blood pressures shoot up. If you don't give anything at all, the patient will start moving and wiggling around and it's impossible to do the operation. The surgeon has always asked us to paralyze the patient. It backed up by saying other experts have supported this criticism of the guidelines issued last year by the Intensive Care Society, which represents doctors, that anesthetic is not necessary. The doctor goes on to say, I am worried about the process in which these donor organs are obtained at the moment because it is not necessary to give anesthetic to a patient who is having his organs removed. In fact, numerous people have woken up after they have been declared brain dead and scheduled for an organ harvesting procedure. Some people have woken up actually on the operating table, fortunately for them, before they've been injected with paralyzing drugs. And we're not talking about people that are in a permanent vegetative state for the rest of their life. We're talking about people that were in a coma that completely recuperate.
I was unable to move, to speak, to open my eyes. I was what they call locked in. But I was fully conscious and aware of what was going on around me. And one of the awake times, I heard multiple footsteps coming into the room. And one male voice saying, this one's a sad case. Young woman, 2 small children at home, her husband is being completely unreasonable. If he would just sign the forms, so many people could benefit from her organs. And I thought, you can't have my organs. I need my organs. There was another voice spoke up and said, "Doctor, is it appropriate to talk like this in front of the patient?" He said, "Hello, she's brain dead. She can't hear anything. She doesn't understand anything. There's nothing there. She only has about a 1% chance of coming out of this coma. And if she does, she'll be a vegetable." It was less than a week later I came out of the coma. There is no true standard for diagnosing brain death. It's very subjective. One doctor's opinion of brain death is different than another. You cannot necessarily trust a diagnosis of brain death as being truly dead.
Then there was the famous case of Colleen Burns. Colleen was a young woman that attempted suicide by drug overdose. She ended up in a deep coma, and she was diagnosed brain dead. At that point, her family agreed to allow her organs to be donated. Between the time that they agreed to that and the harvesting procedure itself, Colleen started to wake up. She started showing obvious signs of life. She started to respond to pain stimuli. Her nostrils started flaring, and the nurses noticed she's obviously waking up. They told the doctors. Well, what did the doctor say? He told the nurse to give her Ativan. Ativan is just like Valium and Xanax. It's an anti-anxiety drug. That's its only purpose. Why would you give a brain-dead person an anti-anxiety drug? Possibly to keep them quiet and calm until the procedure starts. She's actually one of the patients that woke up, opened her eyes on the operating table right before the drugs were administered. She fully recuperated. She lived for another 2 years, and then she had another suicide attempt, and she actually did kill herself. But regardless, it's not about death. It's about cutting people up while they're still alive without anesthesia for hours. Now at this point, I also want to point out an important legal matter. If you have ever signed up as an organ donor on your driver's license or anywhere else, and at this point you've changed your mind, you can't just tell your family that you changed your mind, you don't want to donate. Because in 2006, most all states passed the Uniform Anatomical Gift Act, which states, among other things, once someone has signed that they're an organ donor, the family does not have the right to retract it. Now, if you have not signed up as an organ donor, your family can and will be pressured to donate, but it doesn't work the other way. If you want to get out of it, you have to actually fill out a form that states you no longer wish to donate. And if you hit Google in your state, you should be able to find the forms easily enough. I'd like to show you a couple of highlights from this Organ and Tissue Donation Resource Manual. This is from a document turned out for hospitals by an organ procurement organization known as an OPO. Currently, there are about 60 federally licensed OPOs operating around the country. They are nonprofits. However, the executives of these companies can easily make millions of dollars a year. This one has the specific requirements and the instructions for the hospitals that are doing the harvesting. And if you notice, under medications, it clearly says paralytic agents for spinal reflexes will be administered. Other anesthetic not needed. This is not specific to this one organization. This appears to be a worldwide standard. So, without a doubt, anesthetics are not given when they're harvesting organs. Now, at this point, any hospital in the U.S. that accepts Medicare or Medicaid is legally required to work with an OPO and a tissue bank. And this document also goes into some really interesting facts about how they force the hospitals to notify them of an impending death before the family is even notified. For instance, within 1 hour, all patients who meet any of the following criteria: if they're ventilated with severe neurological injury, if there are plans to discuss withdrawal of life support with the family, at the first indication a patient begins to lose neural reflexes, or prior to the first formal brain death exam. So before they even test for brain death, these OPOs are notified so they can start planning to pressure the family into donating organs. And when it comes to pressuring the family, they have it worked out to a science. Part of this document also talks about the team huddle and the family approach. No member of the donation team should mention donation to a family before participating in a team huddle. The team huddle assembles as many direct caregivers as possible prior to the family approach and creates a forum for exchanging information about the donor and the donor family. So in other words, before the family members are even told that their loved one is possibly brain dead, these OPOs are organizing all the nurses and doctors, gathering as much information as they can about your family, so they know exactly what buttons to push to force those family members into signing those papers so they can harvest those organs. If that's not sinister, I don't know what is. And ultimately, if you're not already a signed up donor, your family is going to make the decision to do it. Now, how many of your family members would realize that they really don't have specific protocols on how to test for brain death? They don't know that. Unless you happen to be fortunate one of your kids happens to be a neurologist. Well, most of us aren't in that situation. Our families would have no clue. They're going to get railroaded into donating organs. I would just like to state for the record that I absolutely do believe brain death is a real condition. There's been numerous cases where they've done autopsies and people's brains have literally liquefied inside their skulls. So it's definitely real. The question is, can you trust the people doing the diagnosis when you're looking at the possibility of organ donation without anesthesia? Now, having said that, we've already discussed there is a lot of money involved in this. A heart transplant alone costs over $1 million. In addition, you've got the pharmaceutical companies where anti-rejection drugs can easily run $50,000 a year. So they have a lot of money to put out a ton of marketing propaganda. If you just search YouTube for organ donation, you're going to be amazed at the hundreds or maybe even thousands of videos that come up pushing people to donate. And they convince you that if you do not want to donate, you must be ignorant. You don't know the facts. Well, these are the facts, and if you question any of them, please go down to the links section. I've got a ton of links from very good sources backing up everything I have said here. I do appreciate you taking the time to watch this video. If you like the content, please take a second to hit the like button. Thank you so much, and stay safe.